So what are the benefits of DBS over a lesion surgery? Deep brain stimulation surgery can be done on both sides. You cannot do a lesion on both sides because there are many more side effects. But with DBS, you can do it. It's reversible. So in the future, if something better comes along, these leads can safely be removed with no neurological sequelae. It's adjustable and programmable. So Parkinson's disease is a progressive disease. It continues in spite of deep brain stimulation surgery or in spite of any of the medicines you're on. The disease process continues. But the thing with deep brain is that we can adjust and we can program. So we can change many different parameters to fine-tune it to, as the disease is progressing, we can increase the stimulation to control more symptoms. What are some of the disadvantages? It's more expensive. But they did a study over 5 to 7 years. Now, because with DBS, you can decrease the amount of medicines you're on and have better quality of life, they found that over a period of 5 to 7 years, the overall cost was the same of patients who were treated with just medicines comparing to patients who had the deep brain surgery. You need to frequently come in to have this thing programmed. Because, like I said, as the disease is progressing, we're going down on the medicines, we might need to keep going up on the stimulation. So patients have to come for having their stimulator programmed, and that is a major time commitment for patients to come, and it might not be a very good idea for people who live far away from a center where they can be programmed. The maximum benefit is not apparent at the very first visit, so you need several visits over weeks or even months before you can have the best possible setting. Other disadvantages are hardware-related complications. The leads might fracture, the stimulator might malfunction, the battery can fail, but these are all easily manageable. There's also risk of infection, which is true for any surgical procedure. It's a very small risk though, but if it does happen, the device has to be removed. Not everyone qualifies for this surgery. Who's a good candidate? So the good candidate should have a garden variety Parkinson's disease, which is like it should begin on one side of the body, gradually progress slowly, and not have one of the other mimics that I told about before. Their symptoms should be responsive to Sinemet. So in spite of having all those side effects, they should at least have decrease in their slowness, rigidity, better movement. If they don't have that, then probably they're not good candidates for the surgery. Patients have, mostly by the time they become candidates for the surgery, they have many troublesome symptoms like off periods, on-off periods, motor fluctuations, dyskinesias, or a refractory tremor. Now, of all these features, all these should be responsive to levodopa or to your Sinemet before you're considered as a good candidate, except tremor. So tremor is the only feature which, even if levodopa is not helping you with the tremor, surgery can help. Like it can give you at least 50 to 80% benefit in this tremor. Patients should not have any significant cognitive impairment or untreated depression. And also one needs to have realistic expectations. So deep brain surgery does not cure. It helps to take control of the symptoms of Parkinson's disease. It can only help you with the motor symptoms. So if you're thinking that the depression or the memory impairment is going to get better with DBS, that does not happen. The general rule is that the maximum benefit that one can expect from deep brain stimulation surgery is equal to the best response from Sinemet, minus the side effects like dyskinesias.
Does it help to prevent other type of things coming on?
No, it will not prevent anything. It will not cure anything. The disease process continues. And if it is a motor symptom that's getting worse, like the slowness or the tremor is getting worse, we can take control of that by adjusting the stimulation, but it will not prevent anything. A poor candidate is just the opposite. These are people who have poor response to levodopa, like they take their pills and it does nothing. It's like having no medicine at all. Patients who have significant cognitive dysfunction, trouble with memory, they're not good candidates for the surgery because, as Dr. Snyder will tell you, this is an awake surgery, so patients need to be able to cooperate and give a feedback during the surgery. So If you have a lot of cognitive impairment, those patients are not able to do that. Even during the programming session, we need a lot of input from the patients. Anyone who's a poor candidate for any other surgery, like a bleeding disorder or uncontrolled hypertension, would not qualify for this surgery. People who need repeated MRIs of their body are also not good candidates, because once you have the deep brain stimulation, you cannot have a whole body MRI, just the head MRI. Anyone who's not or who is unable to attend those frequent programming sessions would also not be a good candidate. Advancing age is not necessarily a barrier, but if you have impaired cognition, forgetfulness or diminished decision-making ability, and plus if there's a lot of brain atrophy or shrinkage, then the results of the surgery might not be optimum. So in conclusion, we have multiple treatment options to help our patients with Parkinson's disease, and every patient is different, so what works for one patient may not work for another patient. So essentially everyone needs their own custom-tailored plans. It's a team effort between the patient and also the physician, that is the neurologist, the neurosurgeon, physical therapy, occupational therapy, and medicines are only a part of the multidisciplinary approach necessary to treat Parkinson's disease. And I thank you all for your attention. Yeah. Are there any questions? No, a PET scan is not a contraindication. You can have a PET scan.
When you have a PET scan, does it determine anything?
PET scan for?
For Parkinson's.
It's not, you can have a PET scan to make sure you don't have any other kind of disorder that can mimic Parkinson's disease, but in Parkinson's disease by itself, it's not much of a role. An MRI is the better study. Yes?
Is stem cell being sought as a potential for further improvement in the treatment of Parkinson's?
Stem cell surgery is still experimental, and the results that have come out of all those experiments have shown that people had a lot more dyskinesia, which is a lot more abnormal movement. So it's still experimental, not advocated routinely.
My wife has Parkinson, and she's on Requip XL right now for about a couple of months. Some days she's perfect, and the next day she'll be completely out of it, like, shaking and can't walk. And we can't figure out what we're doing wrong on the days that she's off with her diet, or sometimes she takes Valium and it'll work, and sometimes she says the Valium makes it worse.
Right.
So we're like at a loss.
Right. That's a common situation with people with Parkinson's disease. So it's not a steady disease. Every day is different. They have their good days, they have their bad days. That's just the nature of Parkinson's. Things you can do if you, does she take...
be a candidate for this then?
She'll need to be evaluated. So like I said, when patients are being considered for the surgery, they come to see us without medicines. So we do something called a UPDRS score, which is a rating scale. And I see how people are doing without their medicines. And then when I give them a full dose or a little more than their regular dose to see if they had any benefit. So I do the UPDRS score again, and I look for at least a 30% benefit. If I see that benefit and the patient does not have other things that would make them a bad candidate, like cognitive impairment or any other medical comorbidity, then that patient can be considered.
When she don't take the XL Requip, sometimes she says she's better without it than when she's with it. I can't understand that
Yeah,
at all.
I hear that a lot from my patients as well. But again, like I said, the disease can fluctuate. Every day is different for people with Parkinson's. And if they're being considered for the surgery, we need that 30% improvement once they take their medicines.